Hassan.
Well, thank you, Mr. Chair, and thanks to both of our witnesses, not only for your presence here this morning, but to you and your teams. Thank you for your service and theirs, and please take our thanks back to everybody on the front lines. Dr. Cadillac, I wanted to just start with following up on Senator Johnson's line of questioning about what we can be communicating to our constituents about the timing of increased testing availability. You went through, we've got tests at public health labs. Now we're surging up on the commercial side. We've talked about a million plus test capacity, but part of the process here is going to be once the commercial labs get these testing kits, they've got to validate them, right? So how long does the validation process take? So I'm just trying to get to a timeline so people understand when this surge will really be making a difference in their experience.
I think the key thing is based on what's the availability of these tests now, and in terms of delivery, they're beginning delivered now.
Right.
That in the public health labs, that'll be increasingly by the end of next week, you'll probably see very high capacity and capability. So about a week, and then you can imagine that the commercial laboratories will be lagging about a week behind them.
And then how long does the validation process take?
It takes several days, a couple of days to do that.
For each kit?
For basically, no, it's the machine and basically validating the test itself on the machine and the people who have to basically work the machines and the test kits.
So I think it would be very helpful, and I want to move on to some other questions. I don't want to belabor this, but if the administration would put down a timeline so that people could see in writing on a website when to, you don't have to promise an exact date, but when it would be reasonable to expect commercial labs to be able to perform this testing if your doctor suggests you get it. I think that would be very helpful. I wanted to move on to another issue. As you know, Dr. Cadillac, the National Disaster Medical System and other programs play a critical role in ensuring that uninsured and underinsured patients can receive care during emergencies by helping reimburse hospitals. I know that you mentioned earlier in the week that this issue was under discussion within the administration. Can you provide an update on those conversations and more broadly, what the administration is doing to help ensure that underinsured and uninsured patients can receive the emergency care that they need?
Well, ma'am, I'm probably not the best one to answer that with. I think Dr. Verma may be.
Okay.
But I do know that in the supplemental, there's monies to basically support that would basically expand. I think it's about $1 billion, so you were very generous in that allocation. And I think that will be money that will be used for that purpose to basically ensure that we can take care of everyone, literally everyone who's afflicted with this.
All right, I will follow up with Dr. Verma to be sure, but it's going to be an important issue, and if we need more resources to make sure that people are not only getting the care they need, but once getting the tests they need so that they will not be infecting other people. Earlier this week, Dr. Cadillac, I met with New Hampshire's public health officials. They have in-state stockpiles of protective equipment such as masks, but they recognize that their stockpiles may be quickly used up, and we've already had at least one confirmed case in New Hampshire. Public health officials in my state have attempted to order more supplies, but they were told such supplies are on back order until May. Based on your testimony earlier this week, I am concerned that the National Strategic Stockpile won't be sufficient to meet the demand. What is the timeline for getting the equipment in the field, and how will you advise people to protect themselves in the interim?
Well, ma'am, we've taken a multi-pronged strategy to basically address what I think is your point, which is unless you have it on hand immediately, you're going to face some challenges. And so one is we have a stockpile, a limited stockpile right now of masks. When I say masks, surgical masks, N95 respirators, and we are in the midst of procuring more immediately, meaning tens of millions, and then have introduced or released as of yesterday a request for proposals for 500 million N95 respirators to basically be provided over the next 6 to 12 months.
Okay.
So the intent is that will ramp up.
And the supplemental provides funding for that
Yes,
so
ma'am.
that the manufacturers know they'll get paid. Okay,
Yes, ma'am.
so do you have a plan in place to ensure that firefighters, public health officials, and other first responders are appropriately prioritized for receiving the equipment?
And we've met with the manufacturers yesterday, and I think that's one of the conversations we're having. They're making allocations on their own, and I realize that in the course of, let's say, just these N95 masks, in a given year, only 10% is used by the healthcare professionals and lump in the first responders. And so much of it is used by construction, mining, and manufacturers. So the FDA has given an emergency use authorization to allow non-medical masks to be used by a broader population, first responders included, and we're going to try to work to see if we can get an allocation to make sure that those first responders are covered.
Okay, so that is helpful to know. In addition to states needing these supplies, it's going to be important to provide training to any responders or providers who will be tasked with assisting or treating coronavirus patients. What efforts are underway at the federal level to ensure that responders and providers can access training on the use of personal protective equipment?
Well, thank you, ma'am. One of the critical things, and again, a product of Congress's work, has been the National Ebola Treatment Network that was created post the 2014 Ebola event.
Right.
And so with that, there was more generous monies then than now to basically address not only 10 regional centers, 3 national centers of excellence, but we've also, like in the North New England area, started a regional disaster health response network with Mass General Hospital that's working with your catchment area to basically train and prepare people. So that will be one mechanism. We can get training out and specific information on how to manage these coronavirus experts. And actually, we use some of the people from Mass General in the repatriation of the people from Diamond Princess.
Okay, I think it's going to be important. It's something that I asked Acting Secretary Wolf about yesterday, too, because in the proposed DHS budget, there's actually cuts to programs that train first responders in this kind of work. So I want to make sure we're focused on that. I am just about out of time, so I thank you both, and I thank you, Mr. Chair.
Senator Rose.